Welcome everyone to the Practitioner Patching Podcast. We're so glad that you took the time to be a part of our podcast today. I'm Dr. Stan. We have on here today Dr. Tim, Dr. Jeremy. They're going to introduce themselves here, tell you a little bit about themselves, whatever background they want to share, and why LifeWave is part of their practice now. We'll be doing this the first and third Thursday of every month. It'll be about a 30-minute format. We'll do 10 or 15 minutes of explaining one of the LifeWave technological patches or other uh, possibilities of supplements. We know we're getting ready to release the AM/PM formulation sometime first of next year. We have another product that's I think is going to be some type of magnetic metal that's going to really change people's lives. So we got a lot of things that we'll be talking about, and we're excited as practitioners to be able to share with you why it is that we're doing what we're doing. I started out in the health and wellness industry about 35 years ago and got interested in health and nutrition as a pastor because I was always dealing with sickness and disease, holding people's hands, when they had cancer, when they were dying, nursing homes, shut-ins. I was not in the best of shape, had a lot of health challenges, nothing life-threatening, but long story short, I was sick and tired of being sick and tired and dealing with sick and tired people. Not that I didn't love ministering and helping people, but I was looking for answers. And so I started asking questions, and God started putting people in my life, started training me, helping me. I went back to school, got certifications in health and nutrition and herbology, and just kept studying and looking for answers to be able to help people, which really basically turned into a full-time ministry with us, helping people spiritually, physically, mentally, emotionally, connect all the dots so that they could live their very best life. And of course, my motto has always been, we want you to look good and feel good inside and out while we add years to your life to your years, because I firmly believe that's what God wants for each and every one. When we came across this technology, a friend of ours, Alicia, had been basically overcoming some sickness and disease for over 10 years. And quickly, she just shared her story, how that when she started using this amazing technology, she started getting the best reports in her health. That got our attention. We started using it, experimenting it on ourselves, got tremendous results, started sharing it with other people. And that's the reason why we're with LifeWave, because out of all the years that I have been in health and wellness, there's no such thing as a magic bullet, but I have to pause a little bit and say this is almost close to being the magic bullet in a lot of different ways, because I can just tell people if you'll drink a little extra water, start using this technology, you're probably going to see results within 6 weeks to 6 months on average for everyone. Not to say we shouldn't address the other things like spiritual things, health and nutrition. We know everything is important, but that's the reason why we got in, because the technology worked. It started getting results. It's easy, it's simple, it's affordable. You can go out here today and get stem cell treatments that cost $10, $20, $30,000 a pop. Most people can't afford that. So it has been a blessing to us, but also knowing that we have a technology that people can use, and the majority are going to get results very quick with it, no matter what they are suffering from. That's the other thing I love about this technology, is that it's safe to use with anybody. It's not anything that's going to hurt you. It's only going to help you, and it doesn't interfere with anything you're doing, doctor-wise, medication-wise, supplementation-wise. But as we always tell people, today, we are not your medical doctors. If you have a medical question, a medical condition, you need to go to your medical doctor and have them answer your medical questions, because we're not your doctors. So with that, let's start with Dr. Jeremy. Are you on here, my friend?
All right, can you hear me?
I can hear you. I can see you. Share a background and why you're with LifeWave, Doc.
Okay, thanks, Doc. Yeah, I'm Dr. Jay Reister. I'm a chiropractor in Kent City, Michigan, which is north of Grand Rapids. I've been a chiropractor since 2000, so about 24 years now. Um, just like any other healthcare professional, I have a lot of people bringing me things from time to time. Oh, this is the newest, this is the best, it'll change your life. And 99 times out of 100, it's not all that impressive. So I don't listen very quickly, especially after 20 some odd years of doing it and being approached by a whole lot of people to introduce me to something else. So when my cousin brought it to me, I didn't really listen to her. I didn't. But she's been friends with one of our good friends, Dr. Don Verholst, for about 20 years now. So I guess I'm kind of lucky that they've been friends for a long time because she had the opportunity to have him come over to her house. And at that point in time, I did look into it a little bit. I did some research, and the fact that it's a non-transdermal technology pretty much blew my mind. I mean, everything else out there, I mean, you say non-transdermal, and the people that are thinking and listening then look at you funny like, well, what does it do then? It can't do anything at all. And that's kind of what I thought. But when you get the science, wrapped around your head or your head wrapped around the science that it's just like God made the sun hit our skin and tells our body to start creating vitamin D, it's that same photobiomodulation that really intrigued me just for myself because as a chiropractor, what I do for a living is I tell people all the time, I wrestle 25 to 50 people a day. And I'm only a buck 65, buck 70. So it wears on my shoulders, it wears on my elbows, it wears on my wrists. So about the last 5 years, I've been looking for something just to strengthen my own body and to make sure I can keep going. I love my life and I love that I have kids now, but I had them, in my opinion, about 15 years late. So I don't get to retire. So I got to keep on trucking. I gotta keep on adjusting people all the time. So I need a strong body is my point. And so when I heard about the technology from Dr. Don, and he explained that he's helped more people in the last 1 year with this technology than in the last 10 years allopathically, that really, I thought that was a very strong statement from a medical doctor. That really intrigued me, and it pushed me to go ahead and get started. Um, in a matter of, you know, 7 weeks, maybe 8 weeks, the shoulder pain that had plagued me for several years kind of faded away. At that point, I got aggressive and sharing it with my patients. You find something good, you want to share it with your loved ones. I got my whole family is on it. My daughter has special needs. She's got some amazing things going on with her body because of the patches. Um, I don't know if we're supposed to do a little bit of talk about that, but she now knows she's got a right upper extremity. I mean, that's amazing to me. Um, she is 3 to 4 times more active. um, she's in a wheelchair. She doesn't walk or talk, but I tell you what, with these patches, I don't know. I'm not going to put limits on that little sweetheart. So I don't know. I got into it for myself because I thought the science was extremely intriguing, and I wasn't. It had nothing to do with chemicals, so that made me happy. Natural healing is what we're all about as chiropractors. So the science was really, like I said, intriguing, awesome, and mind-boggling. And then you hear people's stories of having some pretty fantastically quick results. Now, I know for myself that yes, I within a few weeks I had better sleep, better energy, better focus, better mental clarity. But I honestly didn't want to give the credit to the patches right away. I kind of, in my mind, I thought it might be placebo. I want it to happen, so therefore it's going to happen. So it wasn't until like the fourth week that I really gave the credit to the patches, just because I was skeptical. I was very skeptical, and it just seemed kind of crazy, kind of Star Trekky for it to work. But the inventor, David Schmidt, Gosh, man, you got anybody out there that is new to LifeWave, get um get some David Schmidt interviews in front of you. Go on YouTube, listen to this guy. What a fantastic human being to follow. Loves the Lord, gives God the credit for what he's done in his life, and I just I respect that a lot. So it's a fun thing to share because, like Dr. Stan said, it's affordable. So it's safe because there's no chemicals. It actually works, which is awesome, and it's pretty darn affordable. So I could go on and on. I've got over 50 of my patients doing it now. That's a good number of patients. Um, I've got, I don't know, a dozen miracles in my office. Sometimes I'll say this in jest. My hands are getting a little jealous because I'm used to seeing miracles in my office, but it's these guys that do the miracles, not this little patch. So no, I don't know. It's been a fun ride. I've been my year anniversary was last week. September 25th was when I started a year ago. So I'm about a year and a week in. Don't plan on stopping. Today we've got a big day. We got a meeting tonight in Rockford. So today's one of those bigger days for me, kind of a bell to bell day where I, get up early and start working hard and I probably won't be home till 9 or 10. So today I've got 8 patches on. I don't wear 8 every day, but on big days I do. So I don't know if anybody has any questions. I don't know what to say after that. It's just been a fun ride so far.
You're doing great, Dr. K. I mean, one of the things I love about, working with practitioners, and, you said it at the very beginning, how that people are always coming to us with something, whether it's a miracle cure, a potion, a lotion, a technology. We get hit with that all the
Yep.
time because people want our opinion. They would like for us to use the products, and I'll be honest with you, sometimes getting to a professional like a chiropractor, a medical doctor, practitioners, there's a little bit of a wall up because we do get hit all the time. But I just want to encourage people who are listening, because we're getting ready to hear from Dr. Tim. Uh, don't be scared to approach professionals like this, because you just never know, whose attention you're going to get and whose lives could be changed if you will just have the guts and the fortitude to approach practitioners. We're not guys. We're not, people who are above anybody else. We put on our shoes every day like everybody else. And we need to help people with this technology. So Dr. Jeremy, we look forward to your input over the next many Zooms that we're going to be doing, sharing what this has done for yourself, your patients, and for the people here. Now, we will be doing some Q&As at the end of the sessions. When we do this, we're going to try to spend 10 or 15 minutes on the technology. Next week, Dr. Kim is going to share about the technology of X39, our flagship product. So he will be in charge of the call next week. Some of us will be on and some of us won't be able to be on depending on, our appointments and commitments. But next week, Dr. Tim, we're going to turn it over to you because next week you're going to tell us a little bit more about X39, but tell us a little bit about yourself and why LifeWave, Dr. Tim.
Well, thank you, Dr. Stan and Dr. J. Awesome. Hi, folks. Good afternoon. My name is Dr. Tim Tagg, and I practice in Grand Rapids, Michigan with my wife, Dr. Kathy. And this month is our 22nd year in practice already. And it went by like that. One second I was in the Air Force, I was working on jet engines, and then here I am 22 years later. But in our practice all these years, folks, we're all about optimizing health because we want to see people get on with their life. There's so many things out there that cause illness and cause sickness. And, again, it's the sick of being sick and just tired and fatigued. And it doesn't have to be that way. And I really believe we've tapped into the wisdom and the knowledge to really look at the body from a physiological standpoint and enhance it so we can optimize. So you can go, grandmas and grandpas can go play softball with their grandkids, and babies can be healthy and kids can be healthy and vibrant and grow and develop. So anyhow, a little over a year ago, actually about a year and a half ago, I had a patient of mine and I'm examining his spine and he had this little patch, this little sticker on his neck. And for about I think it's like 4 or 5 months, I never bothered to ask. I'm thinking it was maybe some sort of nicotine patch or a testosterone, who knows? So one day I'm like, what is that on your neck? And it was so funny. He was so specific. He said, well, it's a non-transdermal patch, and what it does, the infrared light from your body, reflects it back, and it activates these copper peptides called GHKCU, which further activates pluripotent cells. And I'm like, I'm into it. But what I liked is he talked about it being non-transdermal. So there's no medicine, there's nothing that leaches into the skin. So I further started researching the science of photobiomodulation, and that's the science behind the patches, behind this technology. And there's over 1,000 studies total in the science of photobiomodulation and over 100 with this technology here. And it's as David Schmidt, the founder and inventor, says, it's a well understood science. So I weight train a lot and I stay fairly healthy. I eat, fairly clean food and, uh, exercise, weight train and all that. But I'm 51 now and, I'm getting a little bit more sore and, things are, I'm not saying slowing down, but I notice my gait is changing as I get older. And I got on X39, EN, and 49, and really within a few weeks, like I don't get sore anymore after weight training. I sleep better, and I was already a fairly healthy guy. I didn't think I could get healthier. In fact, as soon as I put X39 for the first time on the back of my neck, I can't explain it. I felt more alive. I felt like my light was brighter. And it's funny. This is Jet Mechanic talking like this. So now we're into wavelengths and frequencies and how they advanced health. And it's a dynamic technology. So Kathy got on it and she's getting great results. So we decided to integrate it into the office. And our patients, we do chiropractic, we do clinical nutrition, and this is the cherry on the sundae, folks. I mean, we get the nourishment, we get the support, but this brings an extra added level of support to the body. I mean, it activates copper peptides, it activates cells. There's a patch where it actually supports the endothelial cells of our cardiovascular system, that innermost part of our veins and arteries. And if you look at what you see on your phone and news and all these cardiovascular problems, wouldn't you think it'd be good to support that? Well, that cardiovascular system, veins and arteries can work at their best. Well, there's a patch that helps support that system. So it's been over a year now, and we've patched up. That's kind of our slang for it. We've patched up several patients, multiple types of issues. And like Dr. Stan said, it's like we are not here to diagnose or treat, but we are here um, to provide people an opportunity to advance their health with a simple, and I tell patients all the time, this patch is so easy. It's easier than bottled water. You just patch yourself and then let the activation happen. And I have multiple different types of cases. There's ladies with, severe headaches. And then of course there's the discomfort and the pain and all that. And we get these people patched up and they start responding. But what's nice, folks? There's people now coming in where all they want is they just want the patches. They're like, I'm going to wait on chiropractic. I'm going to wait on the nutrition, but I want to try this patch stuff that my cousin or my friend was telling me changed their life. And it's nice because when they get patched up and for the first time in probably 20 or 30 years, they get this, they're like, I'm actually, it's nice to know what it feels like to feel better. I'm sleeping better. I have more energy throughout the day. So it's kind of shifting like a paradigm in people's health. And then they're like, I'm going to start eating organic food. I'm going to start eating a little bit healthier. And there's Dr. Stan, can I answer a couple of the questions about integration into an office?
Popped up, go ahead.
Okay, just real quick. So how do we do this in our office? Well, we can sell them retail. When you enroll with LifeWave, you get your own little page, you get your own store. People can purchase retail off that, or people can enroll and save money. And being a chiropractor, we get these patients come in with headaches and neck pain and all these things. So we can, as we're helping the patient, and there's a patch out there that actually it helps get rid of the pain signal. It's dynamic, and we'll talk about it in future videos. But as a patient is responding to their care, we can help them manage that discomfort with the patch. And again, it's a non-transdermal patch. There's no medicine going in. So it's the safest thing that you can do to advance your life and your health. And it works on children, adults, and seniors. There's and with a few of the patches, there's an age reversing component. We're chronologically a certain age, but we're biologically a certain age too. And I think most Americans are metabolically unhealthy. So they might be chronologically 55, but they might be biologically 78. There's patches that help reverse that biological age into a younger state. And this is all, there's peer-reviewed studies, double-blind studies, folks, for all this stuff. But you know what's most important is it works. I mean, it's a dynamic, and the results we get and the testimonies we get is just, it's profound, and we hear it all the time.
Absolutely, Dr. Tim. And, it's kind of, again, we, as especially as practitioners, we are skeptical, and we should be. Anybody should be. It's, because we don't want to be peddling some kind of potion or lotion, some snake oil or some, fake product. And one of the things I love about these products is every one of them go through clinical trials before they're released. Our founder very insistent on doing the clinical trials, double-blind placebos on everything that we produce, so that when we tell you what it is that the patch or other technology is doing, we have the clinical studies to back it up. That was one of the things that attracted me, Dr. J, Dr. Tim, was the clinical studies, because a lot of people make claims, but we can back the claims up with the clinical trials that meet all the double-blind placebo standards, independent parties, and all that kind of stuff, which is important to not only just practitioners, but anybody should want to know, exactly, is this product safe and does it really work? And so we have the clinical studies, we have the testimonies, we have everything that backs up what we're talking about. And today, Dr. Don Verhulst is not able to be with us. His son, Donnie, is getting married this evening. So they're doing a big celebration today with them. But Dr. Don, most everybody, our practitioners, know Dr. Don personally. He's a trained medical doctor. He served his internship. And he decided many years ago that he would, instead of using pharmaceuticals, he would use nutraceuticals to be able to help people. It's kind of like the old saying, an ounce of prevention is worth a pound of cure. And so he will be on these phone calls, Zooms with us also, sharing his medical knowledge and why, as a medical doctor, he joined LifeWave. And I think as Dr. He saw great results in the last year with people that he hadn't seen in 10 years combined. That's a pretty powerful statement for a medical doctor or whatever. But we're going to go ahead and get ready to close this one out. We'll be back 2 weeks. We're doing the first and the third Thursday of every month, same time, same channel, same phone number. You'll see our faces. Like I said, some of us may be busy and not be able to jump on, but we'll have 2 or 3 practitioners, maybe 4 on here every time we get together, and we will try to answer your questions. So with that, Dr. Tim, Dr. Jeremy, do y'all have anything you want to add as we close it out?
Well, I just want to tell people that I've had a lot of patients. They'll be very intrigued by the technology. I explain it I do a decent job of explaining it, and they get very interested. And then they say something like, "Well, I'll give it a try." And I stop them in their tracks, because you don't get a prescription bottle from your medical doctor or a big bottle of vitamins from GNC and take a few of them and just decide whether it works or not. So I have a rule with my patients. I tell them, get your doubt brain out of the way first, and then let your Dutch brain come in and save you some money, because the bigger package you buy, the better deal you're going to get. And that's kind of like Costco or Sam's Club. That's kind of a very common theme. But one of the rule I have with my patients is, if you're 20 to 40 years old, plan on doing it for 6 months. If you're 40 to 65, plan on doing it for 9 months. If you're 66 to 120, kind of do the math yourself. You're going to want to dedicate a year to it. And then if you're 100 years old, you might want to dedicate 18 months to it. Because I've had people respond in 1 week, and I've had 50-year-olds be in the middle of their 5th month, and they still think, well, I do sleep better, but my shoulder still hurts. So you got to give this time. Some people that are really, really healthy already don't see a lot of improvements and right away, but it's healing on a cellular level. So do not get discouraged. Get to meetings, watch podcasts, listen to people that have been doing it a long time, and just stay the course. It's like Dr. Tim and David Schmidt say, it's a very, very well understood science. It's out there. The clinical studies, over 80 of them, 70 patents on just the stem cell patch. I mean, the science is there. These patches are not on trial. I've heard that 100 times too, and they're not. They've proved clinically what they do. So when you decide to do it, don't think I'm going to try it for a couple of months, because that's not the right approach, is all I'm trying to say.
Absolutely. Dr. Tim, any last word before we close out?
Yeah, folks, people need these patches, grandparents, kids, moms, dads, uncles, cousins. They need this technology, and you don't have to have that alphabet soup, DC, MD, whatever behind your name. And what's nice about what's nice about this company is there's so much training. There's training all over. There's like lives every day talking about the science and the tech. And they actually, LifeWave just updated, and they made the protocol on enrolling and working your way up the company much easier. And it's a great company to be with. Even if it was not network marketing, I would still have these patches available and still be wearing it.
Yes. And, the good thing I like to tell people, the question is, as far as selling, everything in life is being sold. Whether you go to a doctor, you buy a prescription drug, you go to the grocery store, everything takes money to operate, and there's different models. And really what I love about LifeWave is that you can choose the model you want. If you just want to use the products, pay retail, that's all you have to do. You're under no obligation. But if you want to get the best price, then you can buy wholesale kits if you want to, but you don't have to. If you want to share the products, you can share the products. If you don't want to share the products, you don't have to share the products. You're under no obligation, no auto ships. This is about a technology. Our company is about helping people the way they need to be helped. And so we're sharers, we're not sellers. We're just sharing with you a technology that can change your life. Doctors, thank you so much for jumping on today. I think we're going to have a good time with this in future broadcasts. Like I said, next time we're going to break down X39 by Dr. Tim, and then the other doctors that are be on there will probably chime in, maybe have something to say, and then we'll have a quick Q&A each week. But again, our goal will be to keep it to about 30 minutes because we're all busy and we're just here to help and to serve you. So thanks for jumping on. We will record this. We will make it available for people to listen to this on our pages. So with that, guys,